right, welcome everyone back to the Press Box IMSH 2023 partnership between the Society for Simulation and Healthcare and HealthySimulation.com. I'm Lance, founder CEO of Healthy Sim. So excited to be sitting next to Dr. Ryan Ribeira here at the Press Box in the show, which I've heard is now the largest and most attended event. We've ever had 4,200 attendees, and I think the most number of vendors. So SimX is just down. I can see it from here. Lots of people wearing headsets over there. I can see countlessly, constantly, throughout the last 3 days, we've seen people putting on your headsets. So really excited about that. Founder and CEO of SimX, who is providing virtual reality tools for a variety of different healthcare professions. So tell me a little bit more about the company and the things that you're showcasing as new here at IMSH 2023.
Yeah, happy to. So as you said, I'm Ryan Ribeira. I'm an emergency medicine doc and assistant professor at Stanford and the founder of SimX. And actually, we were born out of my experiences as a medical trainee and my frustrations with the limitations of current sim technology. And we started way back in 2013. We were some of the first.
I remember that. I think I saw you somewhere around Stanford. We were doing a little bit more augmented reality at the time.
Yeah, we experimented with that too. And, and ended up landed on VR as a kind of more mature technology.
Sure.
And yeah, I've been selling it since 2018 and growing ever since. As far as new things we got coming down the pipeline, actually, we're really excited. We recently launched our new marketplace. So we've got about 270 virtual reality scenarios that we built up.
That's
across,
incredible.
Yeah, nursing, EMS, physician training, military medics, like PAs, NPs. We even got some chiropractic and pharmacy stuff on there too.
Right. And let me ask you real quick, who's developing those scenarios? How are they kind of cross-referenced and checked before they get on the library?
So that's a great question, because that's not a trivial thing, right?
We want to make sure
is validated.
Right.
And so each of our scenarios has been developed with a content partner.
Okay.
So usually it is one of our customer institutions, actually, Mayo Clinic, UPenn, Northwestern.
Okay.
Elsevier worked with us on development of scenarios as well.
Right, I think from the Simulated Learning series, which we utilized at the Clinical Simulation Center of Las Vegas 12 years ago, 13 years ago. So we were using that as a way to get started, and here you guys have helped to digitize that and turn it into a virtual reality component. So just expanding those really useful resources. Love to hear that.
So we always have a content partner that validates it. And we have a very robust medical team. Like I said, I'm a doc, but I'm one of 9 physicians on our team. We've got PAs, nurses, and Ps as well.
So the company's been built by clinicians, for clinicians, and just utilizing these technologies. That's great. So tell me a little bit about some of the trends you all are seeing within this space, within the field, that SimX wants to lead and be a help of being a part of.
Yeah, well, so I'll say a couple important trends in VR specifically. So one is like wireless headsets. I tell people all the time, there's not really a reason to buy a wired headset anymore. The wireless headsets are just getting better and better and better. And the beautiful thing too is that allows you to do kind of like walking around locomotion. Early VR stuff, you had to use joysticks to move around, made everybody sick.
Right.
And that's been a big complaint we hear is, hey, VR makes you sick. Like 30-40% of our students can't do it.
Right. But the problem with that is the technology is evolving so quickly that if you tried a headset from say 3 or 4 years ago, it's no longer relevant. So you've got to try the latest technologies.
It's like a flip phone versus the iPhone.
That's right.
How much it's progressed.
Just in the last few years.
Absolutely. So honestly, we've been doing studies on user acceptance of the newer tech in VR.
Okay.
And you're looking at nausea of like 2 or 3%.
Okay.
It is a drastic difference. So that's a big change that we're very excited about. And we're really working to optimize all of our software to just take maximal advantage of those headset capabilities.
Right.
The other big one is, if you look at the Oculus Pro or the new HTC headsets, they are having front-facing cameras so they can do mixed reality.
Okay.
And there's, people who have tried HoloLenses or Magic Leaps. There's a lot of challenges with that type of hardware.
Sure.
This new generation of mixed reality headsets is going to solve a lot of those problems.
Sure.
And provide a lot of exciting opportunities that we're going to be leveraging in the future.
Like facial recognition?
Well, so there's that
Something
too,
like
right?
that, or is that a different component from the cameras that you're mentioning?
Yeah, no, the cameras are front-facing. So they allow you to do mixed reality.
I see. So they're looking forward so that you can start to quickly move from virtual reality to augmented reality or mixed reality and back and forth again. Wow.
Right. But you bring up another good point, which is internal eye tracking and biometric sensors that are coming out that will allow you to really do very precise performance evaluation. So you can say like, hey, you're only looking your patient in the eyes 41% of the time when you're talking to them.
Right.
Average for your level of training is 75. Like, what's going on?
Right.
And that type of precision is really exciting.
Right, or even tunnel vision, and guess what? You missed some things going on over here clinically because we could tell you were really focused over here, but meanwhile we're losing that, stay at the head of the bed vision because we're distracted by something, right? So lots of opportunities there. So, specifically around remote and distance-based learning technologies, we've seen from surveys that we've done to the global community that COVID really obviously kind of increased the utilization of remote and distance-based learning technologies, campus closures, clinical rotation shutdowns, these types of things. So tell me a little bit about what you guys are looking at in terms of, or do in terms of these remote and distance opportunities.
Yeah. So, I'm really glad you asked. I think there's a couple of gentlemen trying to talk to us there. So, this is something that from really the beginnings of SimX, we have seen as a huge value add of virtual reality. Our software is cloud-based, and so very fundamentally, you can have people in different locations join together over the internet and work together on the same virtual patients.
Okay.
Just like you would if you're playing multiplayer video games.
Sure.
Right? And not only that, but your instructor and the person leading the debrief can also be remote. So actually, during COVID, that was a big way that our customers utilized our product. We have some that have headsets in 10, 15, 20 different locations, and they have a centralized staff that all do remote virtual reality medical simulation at each of those 10, 20, 15 different locations.
Right. So now, and that really demonstrates to me some of the power and the potential of not just virtual reality, but digital learning technologies. You can train for anything, anywhere, with anyone at any time, right? And so that really expands out the ability for content specific to clinical learning outcomes to be available to learners. It democratizes access in a sense, and it frees up the limitations of place and time to anywhere, any time.
And it can be a great health equity tool, right? So we know that there are huge health disparities between rural and urban areas because of access to resources, academic medical
bandwidth,
centers, training.
Right.
And so this is something that can bring the really high quality training from academic medical centers into rural communities.
Love it.
And provide some equalization around the skill sets of our providers.
Right. And so we're going to see continued interest certainly in these types of technologies to help overcome some of those challenges. And we've seen people suggest to us that they've seen such success. They're going to continue to invest in these technologies. So I think the cat is out of the bag. Unfortunately, they had to take a global pandemic to do it, but here we are, folks, and it's certainly, I think, moving the industry forward in dramatic ways. So on that final point, what do you think that we need to do collectively as an industry? What are some of the things that we could do to kind of help the field further be adopted by healthcare practice?
Yeah, so I'll say three things real quick. So one, I do think we are kind of on the cusp of a boom in simulation technology, really kind of unlike anything we have seen in a long time. It's not just virtual reality, it's AI development is becoming much more mature.
Incredible,
simulation technologies.
Right.
And I think that there is a huge opportunity there to continue to bolster that. I mean, SimX was a real success story of how academia can help bolster industry in the sense that we came to SSH as part of a simulation showcase, right? And,
back in the day.
Yeah, that was our first contact with the simulation world.
Proof of point, MVP build, prototyping, and showing what could work, and now it's turned into a massive company.
And so there are a lot more opportunities in that way for academia and the education community to help bolster new innovators.
Great.
And I think along those same lines, increasing communication between industry and academia is super critical whenever you have rapidly advancing technologies. Because if you're not talking to each other, then you're losing out on half of the innovation.
Right.
And so, one of the things I'm excited about over the next year is SSH is working with the Corporate Roundtable to hold a Future of Simulation Technology Summit, a white paper that will help both parties get a better understanding of where do the needs lie right now, how are these new technologies being used, where are they going to go in the future.
Fantastic.
And then, finally, at a higher level, I think advocacy, coming together around advocacy.
Yes.
I have a long history of advocacy. My life used to be on the board of the American Medical Association and worked in policy and advocacy. And when I came to Sim, I was a little shocked actually that we don't have lobbyists, we don't have an advocacy calendar or agenda. And the industry is relatively young, but I think it is definitely time.
Right.
I mean, simulation can have a huge impact on quality and patient safety in our healthcare system. and we really need to get that message out.
Right. And if we don't do it, who will?
Exactly. Well, and probably the people we don't want to do it will be speaking about what's going on in medical simulation and to its value. People who don't understand it.
Right.
Right.
So those who are building or supporting it. Right. And just recently, the XR industry, which would mean like HoloLens or virtual reality, Microsoft, Facebook, they came together to fund the XRA. An extended reality trade association, and so they're starting to build that representation, and that industry has really only gotten off the ground in probably the last 7 years or so. So certainly younger industry that is already tending towards those types of things that could help potentially for us as well. So, well, thank you so much, Ryan, for sharing a little bit more about your work, about SimX, and for all the work that you're doing to support healthcare simulation and virtual reality in the space out there. And everyone, you can learn more at simxvr.com. And also at healthysimulation.com, where we're hosting webinars about the company, some of its great resources, lessons that you can learn, as well as product demonstrations. So check it out there as well, and we'll see you at the next one.